Constipation or loose stools can be caused by 6 diseases or lifestyle factors. Now we will find out whether your constipation is due to a disease or lifestyle factors and what is the solution to it. Before we get started, I'd love to know where you are joining me from today. Drop a comment below and feel free to ask any question you have, and don't forget to hit that subscribe button and turn on notifications so you never miss a health-boosting tip from Healthcare One. Number 1 is hypothyroidism, which means that your body has low levels of thyroid hormone. An important function of thyroid hormone is to help with metabolism. Now, if your body has low levels of thyroid hormone, your metabolism can slow down. If your metabolism slows down, your entire digestive process can slow down, in which case constipation can occur. Now, to find out whether your constipation is due to hypothyroidism or not, we will now know what other symptoms of hypothyroidism are there, whether you have them. Symptoms of hypothyroidism include feeling weak for no reason all day, gaining weight even after eating a small amount of food, dry skin, hair loss, memory loss, which means you see something that you forget later, and irregular periods in women. So if you have these symptoms along with constipation, then your constipation may be due to hypothyroidism. Number 2 is diabetes. If diabetic patients do not have blood sugar control for a long time, then at some point their nerves start getting damaged. Now, when you eat food, it first goes to the stomach. From there, it goes to the small intestine, large intestine, colon, rectum, and then it comes out of the body. This whole process, in this digestive process, many nerves are connected here, which means many nerves have to work in this whole process. Now, if diabetic patients have any such nerve damage, then this process can be disrupted. And in that case, constipation can also occur. Now, to determine whether your constipation is due to diabetes, I am mentioning a few more symptoms of diabetes, so you can compare them to see if you have them. Feeling thirsty all the time, having to urinate frequently, especially at night, feeling weak, blurred vision, and suddenly losing weight for no reason. Number 3 is irritable bowel syndrome, or IBS. In some cases, IBS can also cause constipation. The symptoms of IBS are lower abdominal pain and cramps. Cramps can be a sharp pain or a twisting pain, a lot of gas, sometimes sudden diarrhea, and sometimes bloating. And everyone who has IBS knows that they have IBS. It's a very irritating condition. Number 4 is anxiety, meaning if you are under a lot of stress, that is, if you are very restless, then the body goes into flight or fight mode. A simple example is when you have exam week, you may have this condition. Then you may have constipation for some time. Again, there are many people whose workplace is very stressful. Many people are under continuous pressure from their boss, or those who are in the final year of their PhD. This can happen because they have to go through this stress for a long time. Again, many people are actually under stress for a long time for other reasons. So if this anxiety or stress-out condition ends after a certain short term, then there is no problem. But if it continues for a long time, for months, then this can cause you constipation. So to understand whether your constipation is due to anxiety, I am telling you a few more symptoms of anxiety. Worrying a lot when something happens, feeling restless most of the time, sleeping less, and being in an irritated mode. Most of the time means that I feel uncomfortable and that I am in a state of not feeling well. Another is having difficulty concentrating at work or studying. Number 5 is depression. We do not take depression lightly or give it much importance in our society, but it is a medical condition. Let me give you an example of how serious it can be. One of my colleagues is Scottish. He came from Scotland to do his PhD. When his PhD was 2 months away, for some reason he went into depression. After that, he could not do any work. Later, he stopped doing that and went home. Till now, he is at home. He has not returned yet. No one knows when his condition will get better, when he will start again. So why can constipation occur if you are depressed? Since those who are depressed do not like to do anything, what they do is lie down all the time. So the body movement that is needed for the normal functioning of the digestive system, such as walking or doing some exercise, is no longer happening. Then this constipation can occur. Another reason could be that people who are depressed are so depressed that they choose an easy way out by excluding all the foods or activities that are good for the body. In that case, it may be seen that they are eating too much sugary foods or eating too much fatty or trans fat foods. And in that case, they may also have constipation. Now, a psychiatrist can tell you whether you are depressed or not. I am telling you some symptoms. If you combine them with this, then you should go to a psychiatrist. Number 1, you may feel hopeless all the time, meaning you do not expect anything from anyone, or you do not expect anything from yourself. And in the future, you feel worthless. Suddenly you get very angry for which you do not really need to be angry. All the things that used to give you a lot of pleasure, you no longer feel like doing them. You feel weak all the time. You cannot concentrate on any work and you do not feel any appetite all day. Number 6 is not a disease. It is a special condition, pregnancy. Pregnant mothers can also get constipation because when they are pregnant, the progesterone hormone increases a lot in their body. So due to this progesterone hormone, the contraction of the intestinal muscle can slow down, in which case constipation can occur. It is very interesting to see that when we eat food, it goes to the stoma. From there, it goes to the intestine. The intestine is a long tube next to that big sac. But the remaining part of the food has to pass through this whole path. So now they have to contract all the time to pass it. It is called peristaltic movement. So when this progesterone hormone is high in pregnant mothers, this movement can slow down, in which case constipation can occur. If someone has this, you should not take any medicine on your own. Remember that pregnant mothers and children are a risk community. They should not be given any medicine without the advice of a doctor. So now, if your constipation is not due to the diseases I have mentioned, then most likely your constipation is due to your lifestyle or eating habits. Remember 2 very easy things to solve. You should eat a lot of fiber-rich foods and drink water and exercise or run or walk or cycle. Here are some names of fiber-rich foods. The first is the husk of isabgol. You can eat the husk of isabgol by soaking it or eating it directly. When the isabgol husk enters the intestine, it can absorb a lot of water and collects a lot of water there. By collecting water, it will become slippery and increase the amount of stool. As a result, the stool will be heavy and slippery and it will be easier to pass. A study was conducted on 170 constipated patients to see whether isabgol husk increases the amount of water in the stool and whether it increases the weight of the stool. Here it is seen that by eating just 1 spoon or 5 grams of isabgol husk twice a day, the water content of the stool of these patients, meaning the amount of water in the stool and the weight of the stool, significantly increases within 2 weeks. So the first thing to do is to take isabgol husk twice a day. Number 2 is chia seeds. 1/3 of chia seeds are fiber. Another interesting thing is that chia seeds can absorb 12 times more water than their own weight. As a result, after you eat it, it will absorb water and form a gel-like form in your stomach. When that gel mixes with your stool, it will soften the stool and make it easier to pass. In addition, all the foods like lentils or other pulses, kidney beans, peas, soybeans, or chickpeas also contain a lot of fiber. 100 grams of cooked lentils contain about 8 grams of fiber, which is about 1/3 of the fiber you need to eat all day. If you eat 100 grams of cooked lentils, this is where you get it. Number 4 is sweet potatoes. Sweet potatoes contain both soluble and insoluble fiber. A study was conducted on constipated patients. One group was fed 200 grams of sweet potatoes every day, while the other group was not fed sweet potatoes. So, the symptoms of constipation that the group was fed sweet potatoes gradually decreased after 4 days, and you can eat all the vegetables and fruits that you have. Among vegetables, especially carrots, broccoli, cauliflower, eggplant, okra, radish, you will find a lot of fiber. And if you can also eat apples and oranges among the fruits. Now, a very important thing is to drink enough water. For boys, you should drink 3 to 4 liters of water. For girls, 2 to 3 liters of water. Water is very important because you will eat more fiber. After fiber enters the stomach, it will absorb water and become a gel, or it will absorb water and increase the weight of the stool. Where will this water come from? If you do not drink enough water. The second important issue is that all the caffeinated drinks that are available in the market, such as tea, coffee, or all these caffeinated drinks, should be excluded. Many people have this habit that if they do not drink coffee in the morning, they do not have a toilet. In their case, this may be an exceptional case. You can drink a cup in the morning, but you should avoid these caffeinated drinks throughout the day because this caffeine tries to remove water from the body, dehydrates it. This is one of the last 2 words. The second thing was that you have to run or exercise or ride a bike or swim. You have to do this for at least half an hour a day. If you miss this one day, say today, then do it for an hour the next day. And if you miss 2 days, then do it for an hour and a half the next day. That means you should arrange a week so that you can exercise for at least 5 days for half an hour or do the other exercises that I mentioned. Many people see that when they are affected by this constipation, they immediately take medicine from the pharmacy to fix it. These things cannot be done. If you have this condition that you are eating fibrous food, drinking water, exercising, but it has been a few weeks or months and it is not getting better, then you should see a doctor. Which doctor? Gastroenterologist or digestive system specialist. Everyone be well.